Hi, I'm Dr. Max Lingamfelter. Welcome to our introductory video outlining my background and training and the conditions we treat. I'm a board-certified, fellowship-trained joint replacement surgeon with a background in the most up-to-date, cutting-edge techniques, such as robotic and AI-assisted surgery, minimally invasive techniques like small incision robotic knee replacement, as well as direct interior hip approaches. Our skill set includes partial and total knee replacement like uni arthroplasty and PFJ of the kneecap or patella. We also focus on accelerated recovery protocols or ERAS protocols like same-day surgery to make sure our patients are getting back to doing what they love as soon as possible. I began my career in the field of biomedical engineering at the University of Houston, earning the distinction of cum laude and honors in major, as well as several other awards including Chevron and Exxon Scholar. I then obtained my doctorate from the University of North Texas TCOM in Fort Worth, Texas. My general orthopedic training began with a residency at the Rowan University Inspira Health Network campus, where we trained in various facilities from Philadelphia all the way down to Atlantic City. One institution we spent extensive time training with was the Rothman Orthopedic Institute, widely recognized as one of the most advanced joint replacement institutions in the country. I then completed this training with an additional year of fellowship arthroplasty distinction at the University of Minnesota, which is one of the oldest and most well-established academic orthopedic training centers in the country, where we focused on the most advanced and up-to-date techniques in the field of joint replacement and also the most complex cases a surgeon could possibly encounter. Our areas of clinical expertise include arthritis or joint pain of the hip and knee, both operative and non-operative management, meniscal injuries requiring joint replacement, labral tears requiring hip replacement, avascular necrosis of the hip, and failed prior hip or knee replacement. Conditions outside of our focus would include low back pain or lumbar spine pathology, foot or ankle diagnoses, hand, shoulder, or elbow conditions, or isolated meniscal or labral injury not requiring joint replacement. We have close partners that are subspecialty trained to treat all of these conditions and would be happy to see you to initiate the workup and preliminary treatment and then connect you with our care partners for definitive management. When patients ask me why orthopedics, as a biomedical engineer, I had the unique opportunity to work with many different physicians, helping to design medical technology. And during one particular experience, I got to observe an orthopedic surgeon in the operating room. And I thought that was the coolest thing I had ever seen. It was the perfect combination of technology and biology that allowed them to improve patients' quality of lives. It was a very profound experience. I chose joint replacement to focus on because during my general orthopedic residency, I got to work on the joint replacement floor, helping patients recover from their surgery. And I remember one particular patient that stopped me the morning following her hip replacement and said, "Thank you so much. I just had the first night of sleep in the last 8 years where I wasn't disturbed by this pain. So thank you, thank you, thank you." And seeing her appreciation and dramatic improvement in quality of life almost immediately convinced me I had to make this the focus of my career. I'm very lucky that I get to focus on the thing I love exclusively, which is hip and knee replacement. This means I get to do between 300 and 400 joint replacements every year. When I'm not focusing on my patients in clinic or the operating room, I like to spend time with my family, our 3 children, and my wife. We enjoy hiking in various areas around DC and Northern Virginia, and also I like to spend time playing music, hunting, reading science fiction novels, and lifting weights or riding my bike. When I think of the future of arthroplasty and joint replacement, I'm excited about the drastic improvements that will continue to be made to improve the patient's experience, that when they trust us to perform their hip or knee replacement, we will continue to make that experience better and better every year, and reducing postoperative pain, shortening the recovery period. That's what excites me most about the future of joint replacement. This has been our introductory video on meeting myself, Dr. Max Lingamfelter. Thank you for watching. Call us at the number below to help address your hip or knee pain. And please stay tuned for our next video outlining the causes of hip and knee pain and how we fix it.